Good morning, everybody. I'm Muriel Bowser. I'm the Mayor of Washington, D.C. I'm here today to provide the district's briefing on our response to COVID-19. Today, we are briefing from the United Medical Center, one of the district's hospitals, and we are in the Great Ward 8 in Washington, D.C. This morning, we reported 67 new confirmed cases, bringing our total positive cases in the district to 653. Sadly, I have terrible news to report. Yesterday, we learned that a 13-year employee of the D.C. Department of Youth and Rehabilitation Services passed away from COVID-19. His name was Kenneth Moore. He was a D.C. native, and we share our deepest condolences with his family and loved ones. We also share our very deep condolences to our team at DYRS. As this public health emergency continues, we continue calling on residents to stay home if they are not engaged in essential activities. Here at United Medical Center, we are showing our drive-through and walk-up COVID-19 testing site. And before I share more information about how this site will work, I want to remind all residents, if you are experiencing symptoms of COVID-19, fever, cough, or shortness of breath, call your healthcare provider. It is very important that if you are at home and not feeling well, that you talk to a medical professional. Operations will begin at this testing site tomorrow, and going forward, it will be open on Monday, Wednesday, and Fridays. Mondays, Wednesdays, and Fridays as a drive-through or walk-up site. But you should not just show up. You need to call ahead first to see if you can get an appointment. And here's who can get tested at this site. D.C. residents with symptoms who are 65 or older, healthcare providers or individuals with symptoms who work in a healthcare facility in the district, first responders with symptoms who work for district government, and D.C. residents with symptoms who have underlying health conditions. So for now, patients will be referred by their doctors, and in the coming days, we will have a hotline for residents to answer these screening questions. Tomorrow, from the D.C. Armory, I will be providing an update on the district's medical surge plan. Yesterday, I spoke with Speaker Nancy Pelosi about making sure Washington, D.C. is designated as a state in the next phase of federal relief funding. The White House has also been an open ear and is also looking for a solution on the state territory designation, and we appreciate those efforts as well. As we prepare for a medical surge, we all know how important this funding will be for our residents and healthcare workers for the nation's capital. I also spoke with our hospital CEOs about making sure we have all the information that we need to execute a comprehensive surge plan. I also had a conversation with Chairman Mendelson about planning government operations in the coming weeks. So tomorrow we will share more details. But right now, I want to bring up Dr. Nesbitt. Where's Dr. Nesbitt? Actually, Dr. Nesbitt will be available for questions. I want to, before I turn to your questions, acknowledge the wonderful team of doctors and nurses and support staff and administrators here at the United Medical Center. Please give them a big round of applause. And thank you for all of your preparation, including Colleen, who is the CEO of the United Medical Center, and LaRuby May, who chairs the board. Thank you, LaRuby. So with that, we can answer some questions. Yes, Sam.
The person who died yesterday, I understand he was quarantined 2 weeks ago, so before, I guess, a lot of the efforts began. But nevertheless, his union member, says the same thing that they said when they filed the lawsuit, what the correctional officer said yesterday at the jail, basically that they don't have the proper protection. Now, you say you're following protocols, but shouldn't more be done if so many people are that concerned?
Of course, we're doing all that we can, and we're providing our employees with all of the equipment that they need. We do understand, and we expect, I know you've been following the news, and that there could be some guidance changes around masks. And our most recent procurement is to try to get all of our frontline employees the surgical mask. And when we have those, we'll distribute them.
Mayor, do you not have enough equipment to make sure these people have the stuff that they need? Is there a shortage, or what's the issue?
Is your question, is there a shortage of PPE in the nation? Is that your question?
In D.C., that is a shortage.
Is that your question?
That is my question.
Yes, there's a shortage.
So
yes.
You can't provide it to them at this point.
I have explained what we have to do in our city is make sure we have enough supplies for our first responders and our medical staff. And that's exactly what we've done. We have also trying to secure the surgical masks for all of our frontline workers, no matter if they're first responders, but if they're providing essential services.
Of course, they're saying that they're in a contained situation with people, and they've been asking for masks, sanitation, that sort of thing.
Next question.
You don't want to...
I answered you, Sam. I don't know what else to tell. I can't say it another way. I've said it two different ways. What's your final question?
I don't know if it's my final question, but no, I mean, again, when you get these people basically begging, and it seems, at least to them...
Let me just repeat what I told you, that when we have the surgical masks to provide, we will provide them. Yes?
Yes, Mayor. Just kind of curious about the letter to hospital CEOs about the need for an additional 3,600 beds. A couple questions on that. Could you expand as to how you came up with that figure, number one? Are you confident that you'll get that number, particularly the 1,000 by April 15th? And what challenges does the city face in reaching that number?
Well, we will give a fulsome briefing on our medical surge tomorrow. And then we'll be able to explain everything related to my letter to the hospitals.
You say if you're confident that you'll reach that number?
Yes.
Elaborate on that?
I will elaborate fully tomorrow, where we're going to have, and I don't mean to be quick with you, but there's a lot that we want to explain fully to the residents of the District of Columbia about how we're working with fantastic hospitals around our city to be ready for a surge. And what that will include is how they can get their facilities ready, how we can add capacity, how we can also be sure that we are supporting the staffing needs that will come when you add that many beds to a hospital system.
Bowser, if I could somewhat follow up on Sam's question, and I know I saw Dr. Smith here, and you're talking about making the tests available first to first responders who are exhibiting symptoms, and I'm wondering about the Department of Forensic Sciences, who is, doing the testing in the labs. Also, their crime scene units are still going to crime scenes, still going to emergency rooms and hospitals, just like paramedics and police officers. Are they being treated in that same category as police officers and firefighters and nurses and doctors?
The DFS?
Yes.
I'm sure that we can. We're using our whole public safety cluster. But I'll confirm that with our team.
Well, can you? Because I'm hearing that Dr. Smith, in fact, told staff that they weren't qualified as frontline first responders and would not be getting tested by the city.
I'll work with Deputy Mayor Donahue, and we can talk to you about that tomorrow.
Dr. Smith, she's right behind you.
No, you cannot, because we're going to confirm what the policies are. Yes.
Mayor, following up also on Sam and Mark, we've obtained a letter from the medical director at DYRS, and quoting now, it says, as of Friday, tomorrow, we will no longer provide face masks and gloves for routine use by all staff. We'll continue to provide the necessary PPE to staff for working in the isolation, quarantine, and intake reception units. Does that mean that they have to find their own stuff, Mayor?
No, it means what I said earlier, that we will distribute the masks to our frontline workers as we have the mask. It doesn't change, and I'm not sure what you're referring to, but that's you heard it from me.
Is Condra Tyler Bainham the medical director at DYURS?
I don't know. Yes.
Question either for you, Mayor Bowser, or for Dr. Nesbitt. How many long-term care facilities are in the city? How many people in those facilities have tested positive? And the third part of that question is, what are you doing to stop any outbreaks from happening at those facilities, if any have happened?
Are you asking me the number? Dr. Nesbitt, do you have that off, the number of long-term health care facilities?
So we have cases reported in 4 long-term care facilities in the District of Columbia. One long-term care facility has 4 cases, another has 2 cases, the other 2 have both reported a single case. All of our long-term care facilities have had very aggressive plans in place since the beginning of March that include a restriction on visitors into the facility, including people who were previously coming into the facility for business purposes as well as volunteer opportunities. According to CDC guidelines, when a case is diagnosed in a facility, they increase their practices, which includes having all of the staff in the facility wearing masks, not just staff who are caring for COVID-positive patients. So as we work with the facilities, we begin to implement those more strict practices. There are also things that are done differently in a long-term care facility because of the types of patients who are in or residents who are in a long-term care facility, their underlying health conditions. And so we work with the long-term care facilities to be able to do those things. The configurations of long-term care facilities are different. So all the guidance is based on a case-by-case situation and understanding of the floor plans of each of those long-term care facilities. So the guidance is not the same for each of the long-term care facilities. Some of them may cohort patients and cohort staff. What it means to cohort staff is that you may have the exact same staff providing care to the COVID-positive patients where feasible. Some others may not have the ability to do that. So again, we work with each facility on a case-by-case basis to make the decisions around the guidelines.
Can you say what those facilities are? The ones that one has 4 cases, one had 2, and one had a single case?
The facilities involved to date are United Medical Nursing Center, Carroll Manor, Unique, and I'll have to get back to you on the most recent facility. I don't want to mispronounce the name, but I can give it to you before we end today.
Mark.
And I know you've been asked about this almost every day, but the employment numbers, we're getting the new numbers nationally now, which are staggering. And I know you talked about DOES getting crushed yesterday. I heard from one person anecdotally who waited online 8 hours, finally did get through and got resolved and everything. But what do you make of, you've talked about the peak is not hit. You've been very candid about the number of testing positives, the number of fatalities has not peaked yet. How about unemployment? Has that peaked, and how are you bracing there?
We think that with the peak, I don't know if I can speak to a peak, but we think that we're going to have 6 months worth, according to it's a gross estimate of really heavy use at unemployment services. We think that we've seen the first wave for sure with the very early industries that were impacted. Restaurants, bars, entertainment folks who were shut down at the outset. I think that's a wave. I think that there are a lot of employers that are holding on and trying to keep their employees on the payroll, and hopefully they'll be able to keep them longer and longer, but that they could roll off and start getting seeking unemployment as well. So I think what we're prepared for is definitely at least 6 months of just enhanced calls. We are working on some ideas within the government to get more hands and more call capacity, and we will continue to do that.
And on a similar vein, the new federal policy that has gone into effect for parents who are essential workers but find themselves without child care and now can avail themselves of paid sick leave. Have you notified D.C. government employees who fall into that category that they would qualify for that? Is that something D.C. government employees can take advantage of?
We're working on that right now. D.C. government employees, however, have paid sick leave, as you know.
Do they take the paid sick leave if they're not sick, but they're at home with their kids?
I got your question. Yes, my team told me yesterday that they're evaluating that now for D.C. government.
So you'll send something out to employees?
We will update employees for sure. Yes.
Can you elaborate in terms of what you're doing to handle the increased call volume? You kind of alluded to it yesterday about contracts in place at unemployment services.
The contracts are, I think the first one is done. We're working on the second one that will get us 50 more folks, but we're trying to look for some solutions within our own, within the government.
So the first contract will bring 50 more.
The second one would.
What's the first contract?
22
ones are there right now?
Yes. They're in a call center. Yes.
Question about social distancing. A few minutes ago, we saw you standing over here by the military trucks talking face to face with a person. Do you feel like you have been complying with the social distancing, and do you think maybe you should be wearing gloves or even a mask like a lot of the people around here are?
I'm doing my best. Certainly it's a new way to talk to people and to interact with people. But I think I'm doing a pretty good job. I'm not one who thinks that gloves are a good idea because if you use the gloves and touch your face, you haven't really protected yourself. I personally think gloves will give you a false sense of security. So I won't be wearing gloves, and I'm trying to limit my activities and limit the amount of time that I'm talking.
All right, and a follow-up, we've heard from some D.C. police officers about the process now of getting tested before they come into work. And one of the criticisms is that they're using the same thermometer over and over and over again, but when they're using gloves, they're taking their gloves off after every single test. From the medical director maybe, is that the proper way to do that? Is that a waste of PPEs?
So one of the things that the mayor just mentioned is PPE and how we define PPE and how people use PPE. And we've had a lot of conversations about the global use of the term PPE and people needing to understand that there's different types of PPE, and PPE should be used by certain individuals in certain situations. The gloves issue is one where gloves give people, again, a false sense of security, and people wear gloves as if it is an ultimate sense of protection for them, and then they touch their face often, they don't wash their hands enough, and then they touch multiple surfaces, multiple people, and have multiple interactions without changing the gloves. Gloves, when used, should be changed frequently and should be changed between interactions with individuals. The same things with gowns. If you put on a gown and you don't change gowns between interactions with individuals who are sick, individuals who are healthy, then the gowns confer no additional protection than your actual clothing. That's why gowns are not recommended for use by every individual in the general public. They are recommended for individuals who are providing care to individuals who are COVID positive, or if you are providing actual screening to individuals who are suspected of having COVID-19. So we have to be very clear that when we are making PPE recommendations, we make it with sort of like a fine-tooth comb, and we give it to individuals based on their level of interaction with people. When we have these conversations about face coverings, we have to make sure that people understand it is about what you could potentially have coming out of you as a secretion, as well as your perception that you are protecting other people, secretions for coming into you. So that's the duality of a face covering. If we don't properly educate people on the use of face coverings, then people will have a face covering on and touch the face covering more often, have the face covering be wet, and touch the face covering and touch other surfaces, which can actually increase the risk of transmission. So there's a lot of education that has to go into the use of face coverings. They're not a benign device. So there's a lot that goes into PPE use that we need to make sure that as we increase the use of PPE, in particular face coverings and gloves, that we're not giving people a pass to not apply to social distancing as our best strategy, and staying home as our most effective use for decreasing transmission. Yes.
I'm just kind of Mayor, I just asked a question. Can I ask the question?
I'm sorry?
You've overlooked me twice.
I just called on Darren. He had his hand up.
Well, I had mine up. He said I can speak. Can I? I noticed that
Darren, that was your question.
I noticed the
yes.
Ward 8 council member is here. I'd like to hear from him. Is that possible?
Absolutely.
White, they put out a list of wards yesterday and the number of cases in each ward. Ward 8, this ward here, had just 44 cases, less than any other ward in the city. What are your thoughts about that?
My thoughts is that there are a number of people here in the ward that have not got tested and don't know where to go for testing. Traditionally, we've been advising our residents to go to their primary care physicians. Some of them have been told that they don't have testing kits, and so I'm thankful that the mayor and the professionals here are setting up here at United Medical Center to ensure that those residents who don't have access to cars or can't travel can come here to get tested.
I notice you're wearing a mask. Tell us why you've decided to wear one.
As you know, I interact with a lot of people, and I have a family at home too, and so I just want to take as many precautions as I can to ensure I'm not taking anything home. Thank you.
Mayor, I'm kind of curious in terms of what are the police department and fire EMS contingency plan should a large number of members go out sick, and what's the breaking point number for those agencies? What their plans are, what their breaking point number is for those agencies.
Let me turn to Deputy Mayor Donahue.
Every public safety agency and every agency in government has a COOT plan that 2 months ago they were asked to update for the pandemic. So let me mention the two agencies that you specifically referenced. So Fire EMS has 4 24-hour shifts. So you work one day and then you have 3 days off. And that's just how they're structured. In addition to that, Fire EMS has staffing levels that each day are above what they need each day. In other words, they always assume they'll have a certain number of individuals on annual leave, sick leave, disability, so they staff at 30 or to 40% above what they need for each of those 4 shifts. So I want to give you that as context. So what happens when there are outages, when the people are out, they first pull from that 30 to 40% of staffing that's above what they need each day. As they draw down, then exhaust that, they use overtime, and overtime in which is prioritized often for individuals who may carry over a shift, may start a shift early. So they make use of the shifts before and after, let's say you're in that shift 1. If they get to the point, and because of that context I gave you, Fire EMS has the capacity to absorb literally hundreds of individuals who are out, both for COVID and for other reasons. If they get to the point where utilizing those tactics are not adequate, then they can do combined platoons or combined shifts. So they could go to 3 24-hour shifts. They're not there yet, nor are they at the point where they'd be close to having to do that. The last thing to consider for Fire EMS is that call volume. So while they look at outages, they also look at their call volume, and each day their analysts will calculate, based on call volume, what's the relative need they think they'll have in a given day. So if call volume goes down, which it might because not a lot of people are out, that will also alleviate some of the pressure. So they can exhaust, again, that 30 to 40%. They can use shifts before and after. And then if they have several hundred who are out, then they can start combining shifts and going down to 3 shifts, and that's how they'd absorb it. And they have plans and procedures for doing all of the above. For police, it's a little bit different. But the essential tools are the same in the sense that while police don't work 24-hour shifts, they also have the ability to hold individuals over. They also have the ability to cancel annual leave and cancel other kinds of discretionary leave. Now, the key difference between police and fire. Every day, fire has to fill a certain number of seats in their ambulances, trucks, and engines. Police have a little bit of flexibility to have each day a few more or a few less people working in their PSAs. So police can shift their supervisory staff more to patrols. They can also, based on call volume, shift around allocation resources between PSAs. That's not something fire can do. Fire, if they have an ambulance or a truck, they have to fill it with the required number each day. So police have the flexibility, looking at call volume, looking at crimes, to be able to do a daily estimate of what their staffing should be. They too can absorb several hundred outages, far more than we actually have now, before they get to the point. You use the phrase breaking term. I don't use that phrase. I use the phrase, at what point will we have a planned diminishment of service based on attendance, and we're nowhere near that right now.
So, I mean, you used the phrase several hundred, but then you said you're nowhere near that. I mean, DC, MPD, and FEMS have both been at the 170 range, which is close to several hundred. Can you put an actual number?
It is hard to, and I'm not dodging this. It depends on call volume, and it depends on what they see each day, but I will give a little context. So for fire EMS, if they have 200 people who are out, it's roughly 10% of their operational workforce. Police have just under 4,000. So police, it would have to be 400 officers out to hit the 10% point. Now 10% they can absorb without changing any service levels using the typical tools, not the extraordinary ones of collapsing platoons and shifts, but holding people over for police adjusting staffing levels. You'd really have to get to 20 or 30% out. So for fire, that would be 400 to 600 people. Police, you're talking, around 800 to 1,000 people before the things that they typically do, they'd have to start coming to the mayor and advising her of taking more extraordinary steps.
Yes.
Can I ask you about unemployment, please? I spoke with an executive chef yesterday from La Diplomat who told me that 2 of the 19 people that were laid off with him have gotten checks, but they didn't get the check for the first week, which is my understanding is that's been waived by the city. Is that a glitch somehow in the system that you're aware of?
I couldn't talk about any specifics about a case that I'm not sure of. The first week to file was waived. I'm glad to hear, and as I mentioned earlier, some of the restaurant workers were the first to apply. Their director reported out yesterday that they had begun receiving checks, so I'm glad to hear that process is going forward.
Have you, though, heard that there's a glitch where even though that first week was waived, that people are not getting the pay for that first week? Have you heard about that?
I have not. And we do expect to have a more fulsome unemployment update at one of these briefings in the coming days. One of the coming press conferences, I should say. Yes.
Mayor Bowser, could you address your concerns about community deaths? I believe the 12th death yesterday was now the 5th community death, someone to die not in a hospital. Nearly half of the deaths in D.C. are now community deaths. That seems kind of scary to those of us sitting out here. Is that a big concern for you? And do you see, and I'm wondering, have you heard from other jurisdictions around the country? Are they seeing that same type of thing playing out?
I have not searched the data, and I'm not sure that I'm not sure about that, but we will look into what we're seeing, and if the regular data reports from the other jurisdictions show that. I'm obviously concerned about people knowing that they can reach out and ask for help. And I can't really say more than that about what's happened with those individuals and those circumstances. But I want everybody to know that they should reach out for help and ask their doctor what to do. Okay, last round. Yes?
I'm just kind of curious as to what percentage of the stockpile requests have you received, and especially given evidence that the Trump administration has favored red states, and how does that compare? Yes, that's the question.
We gave a report out yesterday from our mission support. Was it yesterday or 2 days ago? From our mission support branch about the things that we have requested from the strategic stockpile. Dr. Nesbitt may be able to speak about the medical supplies specifically, and there are many outstanding items.
So I don't have the exact data on me in terms of what we received from the Strategic National Stockpile. We do have, we can get those specific data points to you. The SNS is being distributed on an equitable model based on the number of cases that jurisdictions have. The mayor has articulated before and has articulated directly to the White House, to the FEMA director, and we've had conversations with ASPR as well about our concerns as being only considered as Washington, D.C. and not looking at what's happening in the National Capital Region, as many of the cases in our hospitals are not just for D.C. residents, they're also for Maryland and Virginia residents who access health care in the district. And so when our hospitals and healthcare providers are asking us to help them with PPE and for medical supplies and equipment, we have to take into consideration that they will be serving the National Capital Region and not just the district. So we have made those needs known. We are reporting on a regular and routine basis the burn rate for personal protective equipment and medical supplies to assist us in being able to draw down on those requests in a more timely manner. We have expressed concern that the federal government is stating that the SNS is almost depleted, and if they are unable to replenish the SNS and assist us with further requests, we would find that to be of great concern.
Yes, Mark.
Can I go back to the hospital letter that I believe mentioned that you didn't have all the data or information you needed from hospitals to prepare for the surge? Why is that? Is that a breakdown in communication with the hospitals, or why wouldn't you have everything you need from the hospitals already?
I think we will, and if we don't have it already. I spoke to most of the CEOs last evening after they had a meeting among themselves and received my letter. And it's just a matter of kind of putting a deadline on when we need all the information we need. And I have to say, the executives are appreciative of the citywide planning and the public and private partnership that is underway. And they're doing everything that they can to prepare and plan and to work with us, as are we. So I think that we all should be very proud, the people that are running our systems and the men and women who are going to work every day to get ready for a patient surge. Yes.
So can you go over it again? This is first responders today. But eventually, will anybody be able to come here, and how can they access this place?
I lost my notes that have blew away. Let me read to you. So, as I mentioned, this site will be beginning tomorrow. D.C. residents with symptoms who are over 65, healthcare providers or individuals with symptoms who work in a healthcare facility that's located in D.C., first responders with symptoms who work for D.C. government, D.C. residents with symptoms who have an underlying health condition. They will be referred here by a doctor, and hopefully tomorrow, maybe the next day, in the coming days, we hope to have a hotline number that D.C. residents can call to be referred to this site.
So you don't necessarily have to have your doctor refer you here. You can call a hotline, and based on that, you can be referred
when
here.
we make the hotline available. It's not available right now.
When will that happen?
As I mentioned, we're hopeful it will happen in the next several days. It could be as soon as tomorrow.
Is there an app involved that residents would have to download and use to facilitate coming through this?
We have a hotline.
So no app?
No app, hotline.
And there's a walk-up availability as well besides this drive-through?
You don't have to have a car to access it. Okay. Last question from you when the last round.
So I'm kind of curious about some things at UMC, a couple things. What became of the contact tracing of the ER doctor who tested positive? How many workers have been tested and quarantined? And also, where do things stand in getting the ICU launched?
Let me ask Dr. Nesbitt to talk about what we can say about contact tracing here.
So we have worked very collaboratively with United Medical Center, both for the hospital and the nursing facility, to identify any healthcare providers or any patients who have been involved with any of the cases in healthcare staff or patients at the hospital and in the nursing home. The case that you're referring to related to the physician happened several weeks ago, and so any of the patients and the healthcare staff, I don't have the exact number with me, who were involved were removed from work. Any individuals who identified as having symptoms were tested and were asked to were tested and continued their 14-day quarantine as a result of that. With healthcare professionals, they are removed from work for a total of 14 days. When they become convalescent or have recovered from their symptoms, they're allowed to return to work after that. We do contact tracing to identify if their exposure was related to healthcare or if their exposure was community related. So you can imagine that with widespread community transmission happening in the district, Maryland, and Virginia, where a number of the healthcare professionals who work in district healthcare facilities come from, they don't all live in the district. Their exposure is not always related to patient care. Many of them have an exposure that could have been travel related or as a result of community transmission. So we work collaboratively with the health department of their jurisdiction, oftentimes Maryland and Virginia, to help identify that exposure, and we do the contact tracing and related as it relates to the healthcare facility. Sometimes we are the first to notify the healthcare facility of the exposure. Not all healthcare professionals are informing their employer. We ask that healthcare professionals whose exposure is not related to the workplace notify their employer that they have been diagnosed with COVID-19 as soon as possible so that we can do what we need to do to protect their colleagues and patients and conduct that contact tracing for patients and the rest of the staff who work in that environment because it is critically important that we keep our healthcare workers and our patients safe.
The parts that how many actual hospital employees have been tested?
We'll have to get that number to you. It's not just related to the initial patient that you are employee that you are asking about.
Last question about the ICU. Where do plans in the ICU stand?
So United Medical Center has a very comprehensive plan for medical surge, and we'll be talking to everybody about those details tomorrow.
Thank you, everybody. And tomorrow we are going to roll our briefing in to the presentation that I'm making on medical surge. I want to thank our DC National Guard for being here and General Walker for his assistance with our response and thank them for allowing us to use the Armory tomorrow. Thank you.